Hello. Today we will show you how to use your Medse blood pressure monitor correctly. If you are experiencing inaccurate or erratic measurements during your blood pressure readings, be sure to watch this video until the end. Error 1. Take blood pressure measurements on the correct wrist. The human heart is on the left side of the body, making the left wrist the best one for the most accurate results since it is closest to the heart. Please remember that your left wrist is where you place your blood pressure monitor. While using the blood pressure monitor on your right wrist will provide a reading, it is not as accurate since your blood pressure is not as strong on the right side of your body due to the distance from the heart. If you must use the right wrist because of an injury or other reasons, be aware that these readings do not accurately reflect your blood pressure. Remember, the left wrist provides the most accurate results. Error 2. Improperly secured blood pressure monitor on the wrist. To measure the blood pressure accurately, the monitor needs to fit snugly around your wrist. Secure the device on your wrist so that you can feel a slight pressure from the cuff as you fasten it in place. The cuff should not move freely around your wrist. Loosely affixing the wrist cuff will affect the accuracy of the results. Also, fastening the cuff too tightly will not make the reading more accurate. It may, however, cause discomfort during blood pressure measurements. The cuff should gently squeeze your wrist without causing any discomfort. As the cuff inflates during the measurement, it should not hurt, although it may cause some mild discomfort that lasts less than 1 minute. Error 3. Measuring blood pressure on top of the wrist. You must place the wrist cuff on the inside of the wrist. The monitor needs to detect a pulse. The inside of the wrist, just below the thumb, is the best place that you can feel your pulse since this is the location of the arteries. Never take measurements from the top side of your wrist. Do not wear the blood pressure monitor like a watch to obtain measurements. Bones on the outside of the wrist prevent you from getting meaningful results. Remember, the blood pressure monitor should fit snugly against the arteries on the inside of your left wrist. Error 4. Improperly placed blood pressure cuff on the wrist, either too close or too far from the wrist joint. To obtain the most accurate results, place the blood pressure monitor cuff about 1/2 inch below the wrist joint. You do not need a ruler since your fingers are generally 1/2 inch wide. Place your middle finger against the wrist joint with the wrist bent inward. Place the cuff against the middle finger on the side closest to the elbow. If you place your middle finger against the bent wrist, place your index finger against the middle finger. Applying gentle pressure should allow you to feel your pulse. If the blood pressure monitor is too close to your wrist, the readings will be inaccurate. Tendons on the wrist interfere with the measurement, and the main wrist artery branches into many smaller ones. Both interfere with accuracy. Remember that the best place to measure pressure is about 1/2 inch from your wrist joint. Error 5. Improper arm positioning during measurement. You need to support your arm at the elbow on a surface level with your heart. This placement normalizes your blood pressure, providing you with the most accurate blood pressure results. Avoid placing your arm too high or too low. Rest your elbow on a surface so that your arm remains relaxed and your hand is between your shoulder and your armpit. Important note: not observing proper arm position may result in readings too high or too low for accuracy. Error 6. Repeating blood pressure measurements without a break may also interfere with accurate readings. When you need to take a second reading, wait 5 minutes before you do. You may leave the cuff on the wrist, provided it is neither too snug nor too loose. To ensure a sufficient break between measurements, take the pulse, count respirations, check the body temperature, and think about calmness to help relax. Remember, before the first and subsequent measurements, you should rest and relax for 5 minutes. If you moved from one place to another before or between readings, wait 5 minutes before checking the blood pressure. Drinking alcohol, eating food, smoking cigarettes, doing exercise, arguing, and other stress-inducing activities may change your heart rhythm, which affects your blood pressure. Rest for a few minutes. You must wait until your heart returns to its ordinary rate, since an increased pulse affects the accuracy of the readings. We hope that these simple tips make you measure your blood pressure as accurately as possible. Remember to consult with your healthcare provider if you have concerns about your blood pressure measurements. Stay healthy